Welcome to Roadmap to Sustainable Health and Fitness with Dr. Donatus Chukwudo. Today we are discussing adequate health care. Yes, what is adequate health care? Broadly speaking, adequate health care talks about the availability, the access, the utilization of affordable quality health care within a locality or within a population. And talking about adequate health care really, apart from the general outlook, we are interested in adequate health care as it affects the individuals. And so in that context, we are looking at adequate health care as what those things the individual does to enable or to enhance his health. And you look at it again, you discover that adequate health care could be looked at as in the area of the childhood and then of course the adult. It's all about lifestyle. For children, we are looking at adequate health care as formation of lifestyles that will promote health as per the individual. For instance, we are interested in the child forming the habit of being active or exercising regularly. That is part of adequate health care for the child. The child also forming the habit of eating adequate diet, taking it at the right time. The habit of resting after work. The habit of taking enough water, sufficient water. The habit of once in a while or from time to time getting exposed to even sunlight. And many other healthy habits that the child would require to enable him or her really enjoy quality health. And then for adults, adequate health care is focusing on lifestyle changes, like those who have been sedentary, changing from sedentary life to active life, those who have not been eating quite well as they should, beginning to eat adequate or take adequate diet, those who have not been exposed to sunlight, forming that habit, not staying under AC all the time, because that may not be wonderful for one's health. And so for the adult, we are really talking about adequate health care in terms of the individual being able to make necessary lifestyle changes where that is important. And for adults who may have imbibed such habits from childhood, it will also mean that such an adult will have to continue with such a healthy lifestyle as part of enhancing health or as part of the health care. And that would be a wonderful one. And really, as a matter of fact, we cannot deny the fact that to have adequate health care, there is the need to have the state-of-the-art facility, at least adequate health facilities within an area where somebody can easily access it. Such services should be available. So availability is one factor that determines adequate health care. Another factor that will also determine adequate health care is the access. Yes, available is one. Is it accessible? That's very important too. And if it's accessible, is it affordable? And if it's affordable, the individual should be willing to utilize such services. Because there have been cases where services are affordable, are even free, but then people are reluctant to subscribe to it. Such as when it was time for vaccination with respect to COVID-19, a good number of persons were not willing, even when in many places it was available and free. And so many other times when things were made available and people were not willing. So it has to be available, it has to be accessible, it has to be affordable, and then the individual should also be willing to subscribe to it, whether it costs a little or nothing to get it done. And so if really you are able to access healthcare and enjoy the healthcare services, you will discover that you are going to gain a lot of things. A lot of health benefits will accrue from it. One of them is that such a population will enjoy health. Such a population will enjoy health. Enormous health will be available to such a population. And then also, where there is an outbreak of any health condition, it is easily controlled because of regular checkups. Equally, even for many, when there is a disease, it's easily detected, and that is actually why it can be controlled at that early stage of such a condition. Again, if there is adequate healthcare, cost of health maintenance will be quite cheap. So it will not be so costly for the individual to maintain his or her health. Equally, we want to say that if you enjoy adequate healthcare, you will enjoy overall fitness. You will enjoy longevity. You will enjoy even high productivity. A population where adequate healthcare is available, productivity is usually very high in such an environment. And also, absenteeism from work wouldn't be rampant because people live in good health and they're able to carry on with their work without much ado about nothing. And so that's why it is indeed a good one to have adequate healthcare. There are so many benefits that we could really derive from having adequate healthcare, which time will not permit us to exhaust them within this particular video. And so that is why I will enjoy us to keep following this channel and this program in particular, because we will cover so many other things that will help us enjoy our health and our fitness. So please, if you have not subscribed to this channel, I want to enjoy you. Please do subscribe now so that you can keep following us right on this channel and in this program. And if you have done that, thank God for you. Share it, tell it to your friends, to your family members. Something good is happening here. We are sharing ideas that will help us promote health and fitness, and you will not regret if you do so. So till we meet again, please don't forget that your health and your fitness is not in the hand of any other person, not even in the hand of government. It's in your hand. Take responsibility. God bless you.